Hi, my name is Dr. Ross Hauser. Welcome to Caring Medical Florida in Fort Myers, Florida. Today I'm going to talk about Achilles tendon injuries. The Achilles tendon is basically the tendon that connects the calf muscle or the gastrocnemius muscle to the calcaneus or the lower extremity foot. And we can see here that the muscle tissue is red, but the tendon tissue here, the Achilles tendon, is white. And white means that the blood supply to the tendon, just like ligaments, is very low compared to the muscles because the muscles are red and then the red blood goes into the muscles. White tissues such as the Achilles tendon, tendons, ligaments, meniscus, cartilage, those tissues, because they have a low blood supply, they don't heal as good when they're injured. Most Achilles tendon injuries or tears occur from ankle instability, athletics, normal activity, which then causes an Achilles tendon tear because the Achilles had tendinosis, which I'll talk about, and Os Trigonum Syndrome, which is a very common syndrome that people have. Now we see here the Achilles tendon attaches to the calcaneal bone. That's the heel bone. So if somebody has ligamentous injury around the ankle, the calcaneal bone can move too much, and if it moves too much, the Achilles tendon then tries to stop that extra motion. And because the Achilles tendon is supposed to be moving the ankle, such as when you go up on your toes, or when we're running, how when you run and you push off, that's going to be the Achilles tendon. So if you have an Achilles tendon pain and you also have clicking around your ankle or your foot, there's a very good chance that the instability is actually what's causing the Achilles tendon injury. And thus, to resolve the Achilles tendon injury, you need to also resolve the ankle instability. And how we treat that at the Hauser Neck Center at Caring Medical Florida is with Prolotherapy. I should say the cells that make tendons are the same cells that make ligaments. Those are called fibroblasts. So another term for prolotherapy is fibroblastic proliferation. That's what prolotherapy does. It stimulates the fibroblasts to proliferate and then to grow Achilles tendon tissue. 95% of tendon tears, including Achilles tendon tears, occur in a tendon that's already weakened from tendinosis. So when tendons don't repair themselves, like with athletics, my wife and Mandy, who are friends, Mandy's our operation manager and Marian's our CEO, they get personal training a couple times a week. They're getting in incredible shape. Now, I can guarantee you, even this morning, I asked them how the workout was, and they said, oh my gosh, was that hard? So I guarantee you that they stressed their Achilles tendons this morning. So tendinosis occurs if the Achilles tendon from the workout they did today, if it doesn't repair by the next workout, meaning the workout today broke down their Achilles tendon, because I'm sure they were doing things like with weights where you go up on your toes. So that broke down the Achilles tendon. So if there isn't enough fibroblastic proliferation in their Achilles tendon by the next workout, then their Achilles tendon then becomes degenerated. Tendinosis means degenerated tendon. Degenerated tendon has less cells that are seen under the microscope than a normal tendon, where tendinitis, there's an excessive amount of cells. Sometimes there's just an extra ossification center, or a bone's growing and one of the ossification centers just doesn't unite together, the two parts of bone, and it ends up separate. So Os Trigonum Syndrome would be when this ankle is a plantar flexed, like a person's doing a calf raise. Well, you could see where that might smash into that, right? So the os trigonum right here, that's not supposed to be there. It's going to impinge right there on the bone there, and then the Achilles tendon goes right over that. So that could, again, put stress on the Achilles tendon when a person plantar flexes. And basically with plantar flexion, the person gets posterior ankle pain. One of our staff members, years ago, they had an Os Trigonum, and then you see after surgery. So it isn't that every person needs Os Trigonum surgery, because remember we said 5 to 15% of the general population has it, so most of the time it's asymptomatic. And if it does become a little bit symptomatic, for instance, if the bone there is wearing on the Achilles tendon a little bit, we've definitely had patients where we just do prolotherapy to the Achilles tendon and the pain goes away. So when a person comes into the office, we do an ultrasound. So this is, what an ultrasound of the Achilles tendon looks like. Normal Achilles tendon under ultrasound is very, very white. Tendinosis or tendinopathy is when it gets gray, and a tear is when it gets black. Quinolones, ciprofloxacin, levaquin, and some other quinolones, they're known to cause tendinopathy, and we've definitely had various patients get Achilles tendinopathy. Like this is just a case report of one patient who had quinolone-induced tendinopathy. We did prolotherapy. Often with tendinopathy, especially if there's a tear, we'll use platelet-rich plasma as the proliferant will, under ultrasound guidance, guide the needle right where the tear is. And sometimes it's one visit, sometimes it's 4 visits, but it responds very, very good, even quinolone-induced tendinopathy. And then what we see under ultrasound, it's a little bit hard to see, but it's a very kind of a more black area. And then after you do fibroblastic proliferation with platelet-rich plasma or dextrose prolotherapy, you end up getting this dense tissue that can be seen under ultrasound. So this was a study where they did some prolotherapy, before prolotherapy, after prolotherapy, and the pain, what I wanted to show on this, you could see that before prolotherapy, after prolotherapy, then 2 years later, see how the pain keeps going down. After the last prolotherapy, the tissue is still going to proliferate for months and months and months. So you could see where the pain level, like on a scale of 0 to 10, this is a visual analog scale, so it's actually is 0 to 100. It was 70, then it got all the way down to 16. So if you just take a scale of 0 to 10, it means the person had a 7 level pain out of 10, and it went down to a 1.6. Then this is just another study with dextrose prolotherapy, and it's kind of the same thing. What I wanted to make a point here is prolotherapy doesn't just help the insertional pain where the Achilles tendon attaches to the calcaneus, it also helps in the middle of the Achilles tendon. So you can do prolotherapy in the middle of the Achilles tendon as well as on the insertion. After prolotherapy, it went from 41 to 4 to 55 to 7 to 73 to 12. I mean, it is remarkable improvements. That's what we find too. Dr. Hackett in like the 1950s, he did prolotherapy to various animal Achilles tendons, and there's just this massive influx of cells and the massive influx of dense tissue. So he showed early on that prolotherapy was unbelievable to cause the stimulation of thickened Achilles tendon tissue. And this just shows that with walking, with different speeds, that the tension on the Achilles tendon can be up to 7 times body weight. So you can imagine like how strong the Achilles tendon has to be for you to be pain-free, where if you walk, it's 4 times body weight, and if you run, it's 7 times body weight. So I ran about 4.5 miles this morning. So every step I'm taking or every stride I'm taking with running, it's 7 times my body weight. You could see where at some point the Achilles tendon might get injured because it's so much force. And I just wanted to end with this case report where a person, one of our patients, had a quinolone tendinosis. So in other words, they took antibiotics, and a lot of times it's for urinary tract infections because often they use ciprofloxacin, levaquin, and different quinolone antibiotics for urinary tract infections. Some of the doctors, even the Lyme's disease doctors, they'll use them for that. And sometimes it causes tendon injury. So this person had a tendon injury in their Achilles tendon. Then because of that injury, they're walking kind of weird, which different forces. So they ended up having a hamstring issue and an iliotibial band issue. And then, so we needed to not just do prolotherapy to the Achilles tendon, but also to those other structures. And I should say, quinolone toxicity can affect other tendons. So I wanted to make this video just to go over Achilles tendon injuries, but to let everybody know that you definitely, if you feel like you have tendon injuries from an antibiotic, prolotherapy is a great option. And Os Trigonum injuries, it's good to know about it. And once in a while, they do have to get surgically removed.